Carrie.
Hello, how are you?
I'm great. How are you
Good.
doing today?
I get to work from home today, which is always a good day to me.
Oh, me too.
Yeah,
What are you working on?
I have to grade papers, but I have my exam written for Monday, so that's a plus. And intend to spend my whole weekend in the tree stand. So that means getting this weekend or this grading done today.
That's fun. I am homeschooling my ninth grader, and we just started some new. I just actually got some new curriculum in the mail, so I was busting it open today and trying to get the gist of what I was going to be teaching. Because first, you have to teach yourself on what you're teaching before you can start teaching the person you're teaching. So that's a big exciting. And then tomorrow I have a booth for our products down in Oshkosh. Oh wait, no, that's Saturday, so I have to get all my crap together for that.
Nice. That'll be fun.
It is. I'm super excited. Yeah,
I'm
yeah.
excited.
It's always fun to meet new people and teach them about our products. And it gets a little wild there. There's a lot of people, and some of them are just a little bit kooky for my taste. But I love talking to them anyway.
I like kooky people. I feel like the weirder the better. When they're
Yeah.
too straight laced, then it's not fun to talk to them.
No, it can be quite exciting. Yeah.
We
Yeah.
were actually doing a makeup. So two of my students missed their clinical this week. Well, one of them didn't miss it, but anyways, she got kicked out of clinical. So I had to make them do a makeup simulation. And I did one where my child had a trauma. He fell down the stairs. And so my hope is that they'll start asking me more questions to identify, you know, all these weird things that I put in there. And one of them is that, the 6-year-old and 3-year-old are upstairs in the apartment by themselves. And then the mom and the boyfriend are down in the basement apartment. And the kid has to go outside to go downstairs to go see the mom. Well, he's going downstairs in the middle of the night because he wants some sleepy time brownies. Because mom has been dosing him with sleepy time brownies in order to get him to sleep at night so she can spend time with her boyfriend. And like all these little abuse things that we enroll into the scenario to see how much they can pick up.
Yep.
But we were having so much fun, like being weird with it. And like, they're like, really? Can I have the recipe? I so want to make some sleepy time brownies. We just kept talking about it. And it was, we were laughing and having fun. So it was fun. Anyways, sleepy time brownies. If you got a recipe, let me know.
Yeah. Yeah.
So, anyways, so I was thinking maybe we should talk today a little bit about what we're going to talk about, what it's like.
Stigma.
There you go.
Lots of stigma. There can be a lot of stigma in nursing, and oddly enough, it can come from the medical staff.
Yeah, we talked a little bit about that in the first video because of, I've been diagnosed with fibromyalgia, and anytime you hear the word fibromyalgia, nurses, well, I shouldn't say all nurses, but like ER staff in particular, always seem to like prejudge you before you walk through the door, like, oh, drug seeker. So I never wanted that on my chart, but at the same time, I ended up changing my career and going back and getting my master's and my doctorate degree so that I could teach because I was having so much pain from this fibromyalgia stuff. So definitely stigmas out there from our own colleagues, which is frustrating.
Yep. And eventually, despite what you want, things end up on your chart. And
absolutely.
And the things that people have said to me over the years have been just horrific at times. And I've had some great providers treat me really well, and I've had some providers treat me so horribly. And I've had a number of times where I've had significant diagnosis missed because they've come in with assumptions about me, primarily in the ER, but also in my primary care office. And as a nurse, I've actually sometimes not known what was wrong, and I shouldn't have to know what's wrong to be treated appropriately. But once I had a diagnosis, and you should know, you will know this, but and you probably don't actually know this about me, but I went to both my primary care office twice and the ER twice with serotonin syndrome. Did you know that?
No.
Yes. And the last time I went in, I knew that's what it was. But the problem is, I presented incredibly agitated and anxious, and I have bipolar disorder and anxiety, but I was tremoring badly, and
Hmm.
I was on an antidepressant that is a serotonin reuptake inhibitor, which makes me at risk. And I was on other meds that also increase your serotonin levels. And I had recently started a med. I was on a migraine medication, which interacts with serotonin drugs and makes you at risk for serotonin syndrome. And with those, anytime you come in, and I'm not sure how familiar you are with it.
I'm not
Um,
actually.
okay, so because it's one of those diseases that when you come in with the level of concern you should have is high, because the fatality rate's really high. Because what happens is when you have it, it causes incredibly high blood body temperatures, and then you get all of those things with body high body temperatures. You get seizures, and then you get rhabdomyolysis and kidney failure and death from high body temperatures. So if you see someone come in with multiple medications that cause high serotonin levels and tremors, then your level of suspicion for serotonin syndrome should be incredibly high.
Wow, that's scary.
It is scary, and I figured it out from googling it, because I was jerking so hard that my whole body was jerking like this,
Hmm.
and I also was having tremors like this, and I couldn't write, and I couldn't pay attention. I couldn't look at my computer because I was jerking so bad, and I had nystagmus, and my heart rate was high. And I don't know if my body temperature was high or not, but I'd gone to my primary, and this was going on for weeks at a low level. And the symptoms would get worse, and they would get lower and worse and lower. And it had gotten to the point where I had such confusion. It went on for about a month. And I was having such alteration in my mental state that my dad asked if I had Alzheimer's disease and should I go get assessed, because I would drive around and not know where I was going. I would get very, very confused, and I couldn't figure out. I would leave the house and not know where I was going. I couldn't figure out how to get to my mom's house, and then to get better, and then I would just go home because I'd forget what I was doing.
That's
So
crazy.
in that month, I ended up at the doctor 4 times, and then I went to the urgent care, and then I went to the ER. And when I finally went in, I said, "I think this is what it is." She diagnosed me with agitation. She told me that they were going to send me home because I was rude to the nurse, and Um, and then they sent me to the ER, and he missed it too. But I figured out what it was and stopped taking the medication, my antidepressant, for 2 days, and the symptoms went away. So then I called my doctor and said that's what I thought it was, and he said, "Why did you stop taking your medication?" I said, "I thought it was going to kill me." And he's like, "You just can't just stop taking it suddenly." And I was like, "I've been to the doctor 4 times." Well, the problem is, it caused brain damage. And I eventually saw my psychiatrist again, and we talked about it, and he said, "Well, it'll take a year, and you'll see whether or not the brain damage will go away completely. But yes, serotonin syndrome can cause brain damage." And the brain damage never went away completely. So that is my long story about how. Oh, and when I was in the ER, they told me that they thought it was my thyroid. They
Yeah.
thought my thyroid was probably too high. They were going to draw some blood, and I had to wait 24 hours for the level to come back. But they sent me home telling me I was probably having hyperthyroidism, and I was agitated and anxious because of that, and to just go home and wait.
It's hard. It's hard as a nurse working in the ER to see somebody be dismissed and sent home when you feel like there's something more going on. It's also hard as a nurse to be there as a patient or as a family member and be like, you're not listening. This is what we need to tell you, that you're not listening. This is important, right?
And the
So,
nurse in the ER was quite concerned because when I was on the bed, I kept knocking the rail because I was having such clonic jerks that I would roll to the side and knock the rail.
Hmm.
And I could tell she was disturbed that they were sending me home. She didn't know what was wrong either, but she thought there was something wrong.
Yeah. And
But
sometimes that's how you feel. You got that gut feeling like something's wrong, but you just don't know what it is. And that's where the smart doctors are supposed to come in and be like, yep, this is what it is. But sometimes they just don't know everything. And it's unfortunate.
and this didn't win me. I'm sure this didn't win me any points with him, but I called back and left a message with him that he missed serotonin syndrome and that I just wanted him to know in case in the future he ever saw that again. Um,
I like that.
yes, well, 'cause I was like, could have been fatal. I didn't say that. I was like, I just want you to know that I didn't have high thyroid. I had serotonin syndrome, but that was the presentation, and you know, FYI.
Honestly, I like when I get feedback when I was functioning as a nurse on the floor because that would tell me how well did I do, right? I used to like being able to call up to the ICU or to the floor and be like, hey, I admitted so and so yesterday. This is what was going on at the time. Can you tell me what they diagnosed him with? Or whatever. This was back in paper chart land. And I think HIPAA existed back then, but it wasn't like as profoundly followed as it is
Nin-
now.
1993,
Yeah, I mean, it was obviously in effect when I was working, but between
not like
healthcare
it.
workers, we did allow ourselves to call and be like, I'm just out of curiosity, not because I'm
Yep.
nosy, but more so like, were we doing the right things? Should I have done
Right.
something else? Like I wanted to learn from it. And
Yep.
then all of a sudden we hit that wall where they were like, nope, do not
Yep.
open that chart if it's not your patient at this moment.
Right.
And, I get the whole why behind it. Like, you don't want people looking in charts just for nosiness. But I feel like we're missing that piece of education from it.
Right.
You think I don't know. To me, as a nursing professor and actually as a nurse myself, I like to be able to go back and look at the what did we do and did we correctly diagnose or should we have done something differently? And anyways,
Yeah. I mean, this was not where we started with this conversation, but I as an EMT, transported somebody to the hospital once who it was my second shift as an EMT, and we had paramedics on board, and they thought he was having a massive MI, and I had a really bad feeling that that's not what it was. Um, and I didn't say anything because I was brand new, but I was like, oh man, this feels like a dissecting aneurysm.
right,
And that's what they diagnosed him with afterwards. But they gave feedback to the EMTs the next day because at that point you could call, and they
yeah,
were like, "Oh man, we missed that one." It in the ambulance would not have. Thankfully, we didn't give any treatment that hurt him, but it
that's
was a good learning experience for the paramedics the next time because the treatment is very, very different for a
absolutely,
dissecting aneurysm than for an MI. You know,
absolutely. So, you know, we're talking about stigmas and the way we treat people. I've been taking a lot of care of my parents and my mother-in-law, and previously my father-in-law, and at one point my grandma. And one thing that I think is interesting that nurses do is that they assume that all old people are deaf, so they yell at them. I don't know how many times my father-in-law would look at me and be like, "Why do they keep yelling at me?" Like, I know, they just think you're deaf. I don't know. Tell them you're not. And or a lot of times people will introduce me as, this is Carrie, she's a nurse, or an ER nurse, or they say, this is my daughter, she's a doctor of nursing. I'm like, stop telling people that, because I'm not like a nurse practitioner. I'm a nurse educator.
right,
Yes, I have knowledge, but I'm not exactly on the same level as a doctor, right? But anyways, and so people will like, instead of talking to my mother-in-law, my dad, my mom, they turn and talk to me.
right,
And yes, I like to know the information, but I keep telling my students, like, make sure that you are talking to the patient. So, like, when I have a pediatric patient, I try to talk to the pediatric patient and then look up to the parent who's hopefully standing behind them, or I like position myself so they're behind them. And then I kind of look to them like, are they nodding? Are they like, well, actually, she's really had pain for a week and not just 5 minutes or whatever. But I try to talk to that patient. And um, I think that as our population ages, we as nurses need to get better about not assuming that every old person, elderly person,
Mm-hmm.
is deaf, that they have dementia, that they don't know what they're talking about, that they can't make their own decisions.
Right.
My grandma was 99. My great grandma was 99 when she died. She was like on it. She read the newspaper cover to cover and could like thoroughly discuss it with you. So you can't assume that every old person doesn't know anything. And
Right.
I think that's a big stigma that we have in as our elderly population gets older.
Yeah. Both of my oldest two children are on the autism spectrum, and they are fairly similar. They're both highly intelligent, but they are not good historians or good at telling their medical story. But that doesn't mean that the physicians shouldn't present to them or ask them questions.
Right.
It's just this is something we have talked about before, and we'll probably do a podcast about is how to speak to people with autism. But doctors often make two mistakes. They speak only to the kids, or, and they're actually young adults now, I shouldn't say kids, or they speak only to me. And, there is a combination there that is important, and it's to speak to my kids and then look to me for validation and verification. As we'll get into in the future, it's that the way you ask questions and the way the responses you get are not the same as you would get from someone who's neurotypical.
Right.
And that's important to get validation, but also to, at first, no matter the functioning level, to attempt to honor um, the person you're speaking to. And, there's very few situations where you wouldn't speak to the patient at all, and that even goes, it doesn't matter. There's very few situations where you should not speak to your patients at all.
Well, and as an ICU nurse and an ER nurse, we both know that there's times when we've had comatose patients who are intubated and on medications, and I bet you both of us talk to those patients anyways.
Oh yeah,
I mean,
yeah.
I'm like,
There's
the
almost
sun's
never that I didn't talk to my
yeah.
patient when I was caring for
I'm
them.
like giving them bed baths, telling them what the weather's like or what the
Yeah,
baseball game score is, or, oh, your wife was here yesterday and we were talking about blah, 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 whatever it was. Um, I don't know. I just always talk to the patient themselves as much as I can. But
yeah. It's amazing when you've had comatose patients wake up after days or weeks that they've been in the ICU, how there are sets of memories that they have, and they're often garbled and they're often not right, but they do have flashes of things that they thought happened, and some of them are true. So it's important to talk to them. It's also important to remember that there's things you shouldn't be talking about there, and we are all also, I am sure, guilty of the times that your group of nurses are in there giving a bath and you're having a chit chat session about life. And that gets easy to happen because everybody needs to have that connection and relief. And you're just talking about the four of you are in there, turning a patient or giving a bath, and you're, you know I don't know, talking about what you're going to do for the weekend and how your husband is annoying the heck out of you or whatever.
yeah, yeah, for sure.
But I know. So back to the stigma thing. I have a sister who's brain injured, and she has multiple medical issues as well. And she lives in a small community, and she's in the ER a lot. But she's in the ER for valid concerns, and her primary care is not excellent. And there's been three situations I can think of in her life where she tried going through her primary care. She honestly didn't have good primary care or didn't have established care during one of them, but she's obese as well. And you, you can agree with me on this one. Obese people, there's huge stigma against them. Automatically, you're
For sure.
not treated as much as a human when you're obese. I'd like to say that that is not true, but have you experienced that?
I think so. I mean, I think especially certain doctors and maybe some nurses too, Um, it's almost like, well, it's your fault that you're having issues with your legs or with your feet because you're got so much weight, or yep, you became a type 2 diabetic. Look at your body habitus.
Yep.
Lose the weight, you'll stop being diabetic. Well, it doesn't always work that way. And no matter how they got to that point, we still have to treat them with dignity and respect, and not everybody does.
Yep. And and you don't look farther for other issues when someone is is heavy, and that's what happened. So they missed an extreme gallbladder issue for a long time until she was pregnant, and they had to do surgery while she was pregnant. Um, this most recently, she had been to the, she has hemiplegic migraines. I shouldn't probably really be talking about her without permission, but um, when she has migraines, she looks like she's having a stroke. And a lot of people think she's faking that, except that you really can't look like you're having a stroke on half your body.
Yeah.
It's very hard to fake a stroke. But she can be saying she's having a hemiplegic migraine. She's not having stroke. Please don't give her her 40th MRI in her life. She doesn't need an MRI. She knows she's having a hemiplegic stroke or migraine. And if they look in her chart, they would know that. Um, but she'd been having a problem with a run of hemiplegic migraines every single day for about 3 weeks
Ugh, that's a
almost.
lot.
And so she'd end up in the ER every day, every other day, and unable to eat or drink or take her diabetes medications. And she ended up in kidney failure.
Oh no.
And they sent her home in kidney failure because nobody read the labs. And it wasn't until finally her neurologist walked her to the ER and said, admit her, we're going to actually keep her. What are you doing? Do you not see these labs? She's actually in kidney failure now. Put her in the hospital until we make her better. And they still tried to discharge her. And they ended up keeping her for a week until, and thankfully it was acute kidney failure from dehydration.
Okay. Yeah.
But stigma, you know, and that's all that was.
Yeah. For
But
sure.
that's an example of how badly someone's treatment can go when you're being treated as a difficult patient out of nothing you can help. You know what I mean?
Absolutely.
No condition. You can't help having a brain injury. You can't help at that point being obese or being diabetic, or it's a myriad of other things. And she's got other issues too, besides the fact that she's got the connective tissue. She's a hot mess, but none of it can be helped.
Yeah. Yeah.
But you're not allowed to kill her because you don't want to treat her.
True. True facts.
Yeah.
True
So it gets
facts.
very, very frustrating, and no one's there to help her because, normally in historically when these things are going on, someone from the family is nearby can go with her, and number of us are medical, and we can be there and make an absolute scene. Although both my mother and I have had uh, security walk us out of the hospital.
I can see that with you. I get it.
Yeah,
Although
yeah.
I
I
can see it
mean,
with me too, because I can be mouthy when I need to, and I'm like, no, we're not doing it this way because.
this
And
last time my daughter was hospitalized for 8 days with the encephalopathy, which she couldn't help, but she was also just being nuts out of her brain, very difficult, acting crazy. They were treating her as a difficult psych patient and not a medical patient who was presenting with psych issues. And we walked into a family meeting, and I said, Mike, that's my fiance, I said, I'm going to be the level-headed one, and you be the one that presents with the we're going to do it this way, we're going to do it this way, and that worked about 10 seconds, and then I was just like level 8 with this with this psychiatrist, and Mike's grabbing my leg and grabbing my arm and pulling on me, trying to get me to calm down. And yeah, you know me. And so that was
it's
you're
hard.
judging her based on behavior she cannot control. And then the psychiatrist is basically judging her, making judgments about her.
Yeah,
And yeah, it was stigma sucks.
it does. And mental health is probably the biggest one. I mean, like maybe it's not the biggest one, but it feels like it. Like,
Yeah.
um, I've heard people say, and this is a very negative thing, but I've heard other nurses or people saying, ugh, this is their fourth suicide attempt. I wish they'd just go ahead and complete it already. Let me tell them how to do it. And you're like, what are you talking about? This person's obviously calling out for help. And maybe sometimes it is just like attention seeking behavior. But I don't think you can assume that every person that attempts suicide multiple times is doing it for attention and that that we need to be so negative about it.
Right.
It just, it bothers me.
It's a horrible thing to say. It's a horrible thing to think. How can we even get to the point we think that about someone?
Yeah.
And unfortunately, whether it's stigma against people in pain, because there's huge stigma against people in pain.
Oh, yeah. They're all drug seekers.
Yep. Or they're not really in that much pain because they are sitting here having a conversation. Because I'll tell you right now, my pain level is probably a 6 at this point. I have had a bad few days, uh, and it doesn't really matter what led up to it. But once you have been in chronic pain for a long time, you learn to master it with your mind. And if you can't, then you want to off yourself. Um, and you get used to it. It just becomes this thing you ingrain into your life. And I think that most of you who don't have chronic pain, if you did something that caused you acute pain that made you live at a 6, you probably wouldn't be laughing and doing a podcast, right? But I live at a 4 most days. And so adding 2 more onto it until I get to a 7 or 8, that's when I'm squirming all the time and not able to focus. And I'll probably get done here, and then when I have to move around, I'll be limping and a little bit more. It'll be a little bit more present. But we're doing something right now that's distracting to me, and so I'm able to get through this, right?
Yeah.
And you're there, Carrie. You get it too.
Yeah, absolutely. Pain is not a fun thing, but you definitely have to deal with it. I know when I was an ER nurse and dealing with the fibromyalgia all day, every day, I was in so much pain by the end of the day, I could barely walk to my car. But that patient that you had just before you left can't know how much pain you're in while you're in the room. You have to mask it until you get out.
Right.
And
Right.
that's not an easy thing to do for sure.
No, sometimes you make like groany noises. I mean, I couldn't even back then get off the floor from emptying your urinal without making a lot of like noise while I
Yeah.
got up. But in general, you can't be crying and whining the whole shift about what it feels like. But the point is, you can't judge somebody else's pain. And once you deal with it yourself, this is true of any provider, but often doctors, once they've gone through a procedure that they've done regularly, or they've gotten ill with something they've treated, their thought process on that changes so much.
Yeah.
I watched a doctor put in bone screws once, and he told me that the bone doesn't feel pain, so he didn't need to give the patient anything ahead of time. And I came out of my skin at him because I've had bone screws put in while I was awake because we didn't have enough health insurance for me to have surgery to do it. And we got half through the way through the procedure in his office, and he told me I had to stop screaming so much because I was disturbing the patients. Um, so I know very well it does not feel good. It's a horrible, horrible sensation because you feel it through your whole darn body. Um, so people change their perception on things once they've experienced them, and it doesn't matter if it's a mental illness. It's especially prevalent of depression. You can think panic attacks don't suck real bad for people until you have a panic attack, and then for sure your perception on mental illness changes.
Absolutely. I learned a life hack yesterday for anxiety.
Okay.
It was on TikTok from a
Oh,
doctor.
tell me.
Did you know that if you're in the mode of an anxiety attack, that you can, not that this is a permanent solution, but if you're in the moment of an anxiety attack, you can stop your brain from being in that anxiety mode by eating a really sour candy.
Oh, that's one of the things I have heard. It does not work perfectly, but if you combine it with something else, 'cause that's one of the things my daughter's counselor had taught her. She's got a whole basket of things to work with.
Okay.
But it definitely distracts the body, as does if you're adding or counting backwards at the same time, because your body can't do multiple things at one time, and trying to maintain the panic while you're feeling that sensation in your mouth while you're doing something like complicated mathematics, it does throw your brain out of that loop.
I was honestly thinking about picking up little packages of like sour gummies or sour whatever and taking them to my next exam and passing them out to my students. Like,
Those,
you're feeling anxious, feel free to eat these while you're watching your test.
those little orange hard ball candy. I don't know what they're called. They're sour. I'll get you the name. They work really well because they're a hard lemon thing you suck on, and they
Like,
last a long time.
like lemon heads?
That might be what they're called.
Okay.
Yeah,
Yeah.
because the sour gummy passes right away. It's small, but the lemon heads, you suck on them a long time.
Hmm.
So
So
Alex has a bag of those around.
if I get to the store before Monday, because that's when their next exam is, I may actually bring them and be like, just for funsies, let's try a little experiment and see if this actually helps cut your anxiety so you can focus on what you're doing.
That would be interesting.
And
Wonder
if
how it
not,
works.
have a little sour treat.
Huh. I have one that deals with kind of chronic anxiety all the time. Maybe I'll try that with them.
Hmm.
Well, that was an interesting dive into a whole
Matter.
bunch of different things.
It does seem like that's how ours goes, but you know what? I'm okay with that because it's reality.
It is, and that's what unscripted means. That's what you get when you come on here.
Mm-hmm.
I hope that we give people some useful information sometimes. And please comment
Yeah.
if you find something useful here.
Or let us know if you have other topics you want us to talk about as nurses. Like, I've been a patient for a long time. This happened to me. What do you think? Or what's your experience? I would love to hear it.
Yeah, what's something that we could encourage other healthcare providers to do differently? What's something we never thought of as a healthcare provider?
One thing I wish healthcare providers would do differently is this, and I tell this to my students all the time when I hear them do it. I don't teach the clinical portion anymore, so I don't hear it as much. Stop calling people honey.
Oh God, yeah.
It drives me crazy if a provider comes in and talks to me and they're like, "So honey, tell me about your pain." I'm like, "I'm not your stinking honey.
Yeah.
Stop it." Or they'll do that to my dad. And my dad is not a honey. You don't call him honey. He's just not. And they'll be like, talking to him that way, and I'm like, "Please don't." And then they'll leave, and my dad will look at me and be like, "They really think I'm an idiot, don't they? Just because I have dementia." I'm like, "No, Dad. Well, why do they keep calling me honey? Why can't they just call me Tom?" I'm like, "I don't know."
And
But
especially in the older generation, there are still a lot of people that would prefer to be called Mr. or Mrs.
I actually do encourage my students to ask every single person what they like to be called, and multiple reasons. Well, one is now people don't always choose the name that they were born with to go by for various reasons.
Yep.
And two, it's a sign of respect.
Mm-hmm.
But I guess our assessment teacher is actually telling them to ask them what their gender preferences or their pronoun preferences is. And I said, my way of getting around that is by asking them what they prefer to be called.
Yeah.
So rather than saying, "Julie, what are your pronouns? How do you, whatever," I just ask the patient, "So it looks like your name is Julie Bittrick. How do you want me to refer to you? Do you like to be called Mrs. Bittrick? Do you like to be called Julie?" Do you go by another nickname? And then you will get the occasional person that goes, "Yeah, I know my chart still says my name is Julie Bitrick, but I go by Sean," whatever that is. And then that kind of like preempts that conversation rather than having to say, "This is who I am." I remember having, I'm sorry, I know you were about to end and I keep talking. I remember having a patient in the ER who was a pediatric patient who at the time, and I don't know if they still are or not because I haven't kept up with them, but identified as transgender. And so the first time they came in, and mind you, I was pool, so I didn't work all that much. But the first time I saw them, the mom explained the whole thing of, yep, the name on the chart says a female name, but my child goes by a male name, goes by male gender, pronouns, blah, blah, blah.
Right.
And then they came in the next time I worked, just happened to be that I was in triage again, and I recognized the name, and I don't know how I recognized it, but I did. And so I actually physically walked out to get them rather than just calling them by name. And I said, "I believe you're next. Your name on your chart is, but if I remember correctly, you like to be called Sean or Stephen or whatever the name was." And it was like the relief you could just see on their face that they
Mm-hmm.
were appreciative that they didn't have to repeat the story,
Right.
didn't have to go there again, and I was doing it in a non-judgmental way. Now, am
Right.
I the perfect nurse? No, but in this scenario, it was good because it like really helped them kind of get that comfort feeling, with their healthcare provider.
Absolutely. Because I have a transgender nephew, and that is such a frustrating thing for them.
Absolutely,
But
but
we also have a segment of the population that gets pissed off when you ask about gender pronouns. So if you can avoid that conversation by just saying what's your preferred, what do you like to be called, you
I,
don't have to have the pronoun conversation.
because there are people that are more of a masculine female, but they still identify as female, whether they like women or they like men. Just because they present in a more masculine way doesn't mean they want to be called he, him,
Yes.
or vice versa.
Yeah. And they just think that this whole conversation is a stupid thing to have. So anyway, that's another stigma that it's good that we address that stigma as well, because um, I don't like to stigmatize anybody, and I definitely, when I was precepting nurses, tried to make sure that that was another thing. Is our job is not to be judgmental. If there's something you can teach a nurse or a doctor or a resident or to anyone, it's
Go in with an open mind.
oh, I guess here's one more thing I'd like to say too, and this is super important to me. Please, I guess stigma is also judgment. Don't judge people that want to die. So it's not your job to decide whether or not to present the option to be DNR or to withdraw care. Not your place. This is the family's place, the family's judgment, the person's judgment, their right. So please don't be going in thinking that you're freaking God and you're going to save everybody, because it's not your job.
Regardless of the age. I actually, again, I was on TikTok. I seem to scroll at night, but there was a woman who was defending herself because they had made their child a DNR because they have a chronic illness and they're not going to survive from it.
Yep.
And so the child is actually kind of suffering going through these last months of their life. And they've decided to make the child a DNR and they're getting a lot of slack for it. And you're right. That's a personal decision that we just don't know why they've chosen it. It's kind of like, and we're not going to get political because you and I can get political if we need to, but that's why I hate the whole telling people they can't get an abortion thing. You're right. On average, I don't like the idea of people using abortion for birth control type purposes. I think that's totally wrong. But there's so many times in life when it is appropriate. Like you have a patient with anencephaly, they're born without a brain. If I knew that I had a baby in me that didn't have a brain, I don't know if I'd want to carry it to term or not. I've never
I
been in that
wouldn't,
situation.
because that baby's going to die.
You have a baby that's born. I mean, I had somebody recently that's close to me who they found out their baby had uh, was going to be born with Down syndrome. They were kind of accepting of that. They were getting there. but then the baby ended up having a bad heart and was filling up with fluid, and they knew the baby was going to pass away. And they actually, because of the laws that we had, they had to go into a specific children's hospital and get certain permission in order to get the baby terminated. And she said at the time, I know that the baby's going to die if she hasn't already, or he hasn't already. They didn't know. But please don't have the heart rate monitor on, because I don't want to know if I'm taking this life or not. This is not a choice I would have made had I not known the baby was terminal. But they really had to be cautious about where they could go to get this taken care of. And it wasn't because they didn't want this baby, they wanted it with all their hearts. But people are making it such a hard law for people to make a decision about their own body. And, assuming that every person that wants an abortion is doing it for birth control type reasons is just
Wrong.
wrong. I know.
And some people would rather carry a baby to birth and then hold it while it dies.
Yeah, I did see a lady like that recently too. And she said that 45 minutes of just being able to hold her baby gave her a sense of peace. And that's fine. If you want to carry that baby that you know is going to be terminal, but you know you're going to get that 45 minutes with her, yeah, that's your right. That's your decision. So, all right. Well,
that went a weird place at the end.
I know. I'm sorry.
That's okay.
Sorry, but not sorry, because I think it's a good thing to talk about.
I do too. That's a whole nother podcast.
It is. And we'll get there. You know us. We'll get there.
Yeah.
So one thing that I would like to talk about today, because we like to talk about products at the end that we have. And again, if you don't know, if you go to our channel, we do have links for mine and Julie's pages. So feel free to check that out if we ever talk about a product that interests you. But I have had issues with IBS for forever, since I was like knee high to a grasshopper. I can't tell you how many times I've gone to the doctor for belly pain. And recently started on our pre and probiotics. And I am regular for the first time in my entire life due to these pre and probiotics. And I feel amazing. So, do you want to talk a little bit more about pre and probiotics and why we should take them?
Yes, absolutely. So, a lot of people's guts are very unhealthy from the diet that we have these days. And some people's just don't work right. So our gut microbiome, which is the set of bacteria that we have in our gut, and everyone has everyone's microbiome is even as unique as our DNA. So you can sample a microbiome and you will not find two microbiomes that are alike. And you can actually transplant a microbiome with a fecal transplant. So if someone is sick with a disease or an illness of their gut, so like Clostridium difficile, which is an illness that you get from taking antibiotics, can be fatal, and is fatal a lot of times because you have to get different antibiotics to try to kill the bad bacteria that are in there. But my hospital actually pioneered fecal transplants back in 2006.
I had a friend who had to have that done twice.
Really?
And she's young. I mean, she was probably in her 30s, maybe 40 at the time. And she was so embarrassed. She's like, oh my gosh, I have to make my husband defecate in a bag and take it with me. And they're going to put it inside me.
Yep.
And I'm like, it's okay. It's okay.
Yep. Well, the way we did them is very different than the way they do them now. We won't get into the details. But so they can actually put it into a pill, and then you take it, and it repopulates your gut with somebody else's microbiome, and then it kills off the bad. It replaces the bacteria that you need to make you healthy again. But the funny thing is, if you take a microbiome from a heavy person, you will likely become heavy because the microbiomes are so unique to different people. So the question is, why does that happen? Well, one of the reasons is that when you, this gets into something different that I think I'll bring up really quickly. One of our products is called a GLP-1 activator. Well, when your microbiome is making the appropriate things, it is healthy, and your cells in the lining are able to produce the GLP-1 hormone, which helps with weight loss. But the rest of your cells are healthy too, and you have the right mix of bacteria to keep you to keep your immune system working. This is a whole big thing, and since we have a little extra time, I'm going to talk about it. Your immune system it comes probably a 75% from your gut. So to have a healthy gut is so crucially important. And so the pre and probiotic that we give you help your gut support being healthy. So that's one of the reasons that you would take it. And I never had good gut health either. And I tried many, many probiotics and prebiotics from other companies, but every time I tried to take them, all I ended up with gas
Yeah.
and bloating, and it was horrible, and things never got better. This prebiotic and probiotic I actually tolerated, and I'm doing much better. So, and I've actually had better immune health since about 3 months after starting it. Everyone in my house is sick right now, and I did not get sick.
Yay.
So you get this better immunity from your gut working. Well, so we talked about these people who get fat after taking a fecal transplant from people that are heavy. Well, your gut has to have the right set of happiness in order for your small intestine to be making the GLP-1 hormone, which is the happy weight loss hormone. It does things in your whole body, but it also connects with your brain to make you happy. And if your gut becomes unhealthy, it can't make the GLP-1 weight loss hormone. And so what's happening when you take these microbiomes from heavy people? Well, does it have something to do with this GLP-1 production? I'm not 100% sure, but I wonder if it has something to do with GLP-1 production. And we have a product that just came out that actually makes your body make GLP-1. And one of the things it also does is it helps with your gut health. So it helps you produce the right kind of cells in your gut. It has a part of a probiotic, prebiotic, and you take that every day too. So that's an awesome product you could learn more about as well by clicking on our website. So there we talked about 2 different gut products to make your gut work really happy.
All right. On that note, let's have a great weekend.
Yeah.